Greetings. Today is Prevention Wednesday. Prevention Wednesday is a day lot of health topics and community-wide education and community awareness activities are performed to inform the general public about the leading causes of death or the emerging disease. Because of COVID-19, I've decided to use today, Prevention Wednesday, to bring some information to our young people. And the information is based on series of questions, doubts, challenging concepts about our young people who believe that they are immune to COVID-19. And what do you need to know? I don't have to repeat a whole lot because you've heard so many things. However, getting accurate, correct information from reliable sources can help you and save you a lot of rumor. As you are aware, COVID-19 is a rapid evolving disease and demands immediate attention. As you know, good health is priceless and must be preserved at all costs. Informed community make informed decision when it comes to making decision out of many. And the advent of COVID-19 is just one way that many people remain uncertain about what we're hearing, what you're hearing in social media, on television, and in some cases from your friends. Today's message on Prevention Wednesday is on young people who send texts, who send messages, who communicated one way or the other, who ask questions. Auntie, today is my birthday. Can I invite 10 people to my party? The answer is no. Because you are not sure who has it, who is exposed, or who is about to get sick. So my advice, based on expert opinion, that stay away from those things. COVID-19 is real. Like I've said in the past, it affects your respiratory system. And as you know, oxygen is your lifeline, and you cannot do without oxygen. I will repeat again, our young people, you are not immune to COVID-19. You are not too tough for COVID-19. Young people die just like the old people die. Young people get intubated just like the old people get intubated. Young people get sick just like the old people get sick. The difference though, the population at high risk are people 60 and older. But again, you are not immune. We are all at risk. You need to recognize when you have fever, when you have cough, when you have shortness of breath, and in some serious cases, when you start experiencing chest pain resulting to pneumonia, that's infection in the lung. The question of whether young people can have COVID-19 is real. COVID-19 presents real-time danger and real-time exposure to those who choose not to stay informed or follow the advice. My suggestion to you is that you stay according to the guidelines, according to the advice given to you, either by your parents or by well-informed individuals. Because we have what we call community spread. Community spread occurs in one area. It could be in a family whereby one person is infected and this other person not even knowing that they are infected, because not many people show symptoms. And if you don't show symptoms, you are still a carrier. We consider them as a carrier, and they can infect so many people. What do? Can you get tested? Well, as of now, not everybody get tested, but the recommendation is for people to get tested. What happened to you if you are suspecting that you are experiencing some pain, some fever, or even moderate symptoms? You seek the advice of your medical doctor or healthcare practitioner. The advice is that there is no medicine right now to treat COVID-19. However, clinical trials to test the medicine that will work to treat COVID-19 is in place. My advice: do not take any injection from anybody. Do not take any injection from anybody that you do not know. Because this is a critical time in the world, and scientists are looking for a way to treat or to find a cure for this disease. There is no treatment. There is no known drug. They're treating the symptoms. You buy pain reliever, fever reliever. You keep some fluid in your house, some drinks. You limit your going out. You practice social distancing. And part of social distancing is what we consider social connectedness. We know it's very important. It's difficult for you young people, even me as an adult, to stay home, for lack of a better word, to be quarantined. Social isolation is a danger in itself, but it's better to be safe than to be sorry, because COVID-19 can take your life away and can make that socialness, connectedness irrelevant. So virtual connectedness can be done through telephone conversation, through video conferencing, through gaming, through texting, through email. Can we prepare for COVID-19? Of course, by becoming culturally, age, and community-wise responsive to addressing real-time disease with real-time critical condition. In terms of prevention, you wear your mask if you have one. If you don't have mask, put on your bandana, put on your scarf, whatever you can use to cover your nose and your mouth. To sanitize your hand, wash your hand frequently, as many times as possible. You can never wash your hand too many times. It is advisable for you to do it. It will save you. It will save everybody. I understand. Young people in the rural area, in the villages in many parts of Africa, this is tough because of lack of critical infrastructure to provide running waters, to provide sanitary environment. You still have to do something to stay alive by washing your hand as many times as you can. If you have bleach, in absence of hand sanitizer, you use 2 teaspoons of bleach to 1 gallon of water. That will help to disinfect surface. Some of the surface or surfaces that you may use to prepare your food, to clean dishes, to do other things. Bleach, 2 teaspoons to 1 gallon of water. It's equivalent to 99% Lysol. And this is obtained from National Sanitation Foundation. Yes, we can prevent community spread by staying informed. Have your temperature taken. Unfortunately, not many people have a thermometer in their home. I realize that. If you have vinegar, white vinegar, use that to cleanse your mouth, rinse it, gargle with it, drink some tea, whatever makes you comfortable, coffee, tea, gargle with salt and water. Is there anything you should know? Community support and social cohesiveness is very important because social determinants of health, these are factors that can make you well or make you sick. Where you live, where you walk, where you stay every day, the kind of people you meet, your socioeconomic status, these are all social determinants of health. They can help you, they can break you. With COVID-19, we believe you can do better. You can be a responsible citizen by doing all you can do, by practicing culturally and socially responsible behavior, and by promoting self-care and valuing yourself, knowing that your private decision can be a public crisis. My young people, we want you alive. We want you to stay healthy. You are our next leaders. We want you to be productive citizens. And becoming a productive citizen means that you have to be healthy. Good health is priceless. I will repeat again. The wealth of every nation is defined by the health of the citizen. Unfortunately, for many villages and many communities in Africa, that is far to fetch. We must do with what we have by protecting ourselves, by doing what we can do to make sure that together we limit the spread of COVID-19 through social distancing, through reporting to your medical practitioners if you think you are sick, through staying away in overcrowding. Do not party for now. You can party later after COVID-19. Yes, my young people, you can be infected and affected by COVID-19. You are not too young. You are not too strong. You are not immune to this virus. This virus is deadly, dangerous, and it kills. We want you alive. Stay informed. Informed person make informed decision. Be healthy. And be sure you pass it on to others. Become a peer educator. Become an agent for social change. And together, we can prevent the spread, community spread, get accurate information, and stay informed. My young people, yes, you can die from COVID-19. You can be intubated from COVID-19. You can be critically sick from COVID-19. You can die from COVID-19. COVID-19 is no respecter of age. I'm repeating a lot of stuff because the urgency of your question demands an aggressive answer. And if you think that is too boring, think again. This is in response to a lot of your questions. And thank you. Be responsible, stay informed, and practice social distancing. And do all you can to stay alive and become a productive citizen. Young people are not immune to COVID-19. That's a fact. Thank you.